Why do some large-cell lung cancer patients defy prognosis? Imagine hearing a diagnosis that usually comes with a grim outlook and then surprising everyone by living longer than expected. That's what some patients with large-cell lung cancer experience. Large-cell carcinoma is a type of non-small cell lung cancer known for its aggressive nature and generally poor prognosis. Most patients are diagnosed when the cancer has already advanced, and the 5-year survival rate is often around 11 to 15%. Yet, some individuals beat these odds and survive longer. Understanding why this happens can help us appreciate the complexity of lung cancer and the factors that influence outcomes. Prognosis is essentially an educated guess about how a disease will progress and what the chances are of recovery or survival. In large-cell carcinoma, prognosis depends on several key factors. The stage at diagnosis is crucial. Early detection when the cancer is still confined to the lung offers better chances for successful treatment. If the cancer has spread to lymph nodes or other parts of the body, the outlook becomes more challenging. The patient's overall health, age, and even genetic features of the tumor also play significant roles. Some tumors have specific genetic changes or express proteins like PD-L1, which can influence how well they respond to certain treatments. Recent advances in lung cancer treatment have opened new doors. Immunotherapy, which helps the immune system recognize and attack cancer cells, has shown promise, especially for tumors with high PD-L1 expression. Targeted therapies that focus on specific genetic mutations in the tumor can also improve outcomes. Patients who are healthier overall, who maintain good nutrition, avoid tobacco, and stay physically active tend to tolerate treatments better and may have better survival chances. Additionally, some patients respond exceptionally well to initial treatments, leading to longer periods of remission. This response can be influenced by the unique biology of their tumors or the strength of their immune response. Emerging research continues to explore why some patients defy the odds. Scientists are investigating the tumor microenvironment, immune system interactions, and additional genetic markers that might predict better responses. However, these areas are still under study, and no single factor can reliably forecast who will have a more favorable outcome. For patients and families facing a diagnosis, working closely with healthcare providers is essential. Personalized treatment plans based on genetic testing and tumor characteristics can optimize care. Participating in clinical trials may also provide access to promising new therapies. Maintaining overall health, seeking emotional support, and staying informed about options can positively influence quality of life and possibly survival. While it's heartening to hear about patients living beyond expectations, it's important to remember that large-cell lung cancer remains a serious disease for most. Prognostic tools and staging help set realistic expectations, but individual results can vary widely. Open communication with healthcare teams, setting achievable goals, and accessing supportive care are vital. Continued research and personalized approaches give hope for better outcomes in the future, but early detection and comprehensive care remains the most effective strategies. Remember, every patient's journey is unique, and seeking guidance from trusted medical professionals is always the best step forward.